Good morning, everyone, and happy Tuesday. My name is Nicole Marchand, registered and consulting dietitian, owner of Eat Well Halifax. Today, I wanted to discuss with you the importance of vitamin D intake. So I first want to thank you so much for watching my videos and supporting the work that I'm doing. These videos are for you to share nutrition and wellness information for you. So if you have any topics you'd like me to discuss, by all means reach out to me, and I'm more than happy to do a quick video on anything you'd like me to talk about. So vitamin D is a very complicated nutrient, and we're doing so much work in science on vitamin D, and the more we learn, the more we realize how important it is to meet the needs of this vitamin. It is called the sunshine vitamin because we actually produce vitamin D in the skin through exposure to UVB rays. I call it the sunshine vitamin because of its support in mental health. So with all the research being done around vitamin D, there are a few things that we do know. First of all, we do know that vitamin D plays a huge role in bone and teeth health, mostly because of its aid in absorption of calcium, which is really important for bone health, as we all know for sure. We also see that there's a role in vitamin D intake and the prevention of certain cancers, especially colon cancer and breast cancer right now, and more research is being done in that area as well. We need vitamin D for the role in all of or most of our body systems. So for example, our cardiovascular system. We know that vitamin D helps us prevent or helps us reduce the risk of cardiovascular disease, mostly because it helps us reduce blood pressure levels. Vitamin D also helps us reduce our risk in metabolic syndrome. Metabolic syndrome is related to diabetes and heart disease. So vitamin D plays a big role in our cardiovascular system. It also plays a role in our endocrine system. So vitamin D helps us with hormone balance. It plays a role in our immune system. So it helps us fight off colds and flus. It helps us fight infections. It helps us reduce the risk for autoimmune diseases. So vitamin D is really important in that system as well. It's also really important in the respiratory system. So we know that there's a role between asthma incidence and severity with vitamin D deficiency. And then we see a role in our central nervous system health. So that's where mental health comes into play. So there is a role in vitamin D deficiency in Alzheimer's and multiple sclerosis. We're seeing more evidence in relation to depression and anxiety, even OCD and stress, so lots more work being done there as well. Vitamin D is incredibly important. We're also seeing work in relation to chronic pain, such as fibromyalgia, so that's really interesting as well. So tons of research being done on vitamin D. It's really, really, really incredibly important for us. So it is currently recommended that we take in 400 international units per day. I think that we are going to see an increase in this number as the roles become identified of this important nutrient. We find vitamin D naturally in fatty fish because it's a fat-soluble vitamin, so it's naturally found in fatty fish, sustainable salmon, herring, mackerel, sardines, any fatty fish, as well as in egg yolk. It is also fortified in dairy and orange juice and other foods on the market as well. And we need a supplement, especially between the months of October and May, so during the winter. Some of us, if not most of us here in Canada, need to supplement year-round for vitamin D because one of the reasons you might be deficient in vitamin D would be lack of sun exposure. You might also be deficient in vitamin D or your risk increases for deficiency if you're postmenopausal, even if you're overweight. If you have any issues with the digestive tract or any damage to the small intestine, all of the nutrients that we take in actually absorb through the mucosal membrane in our small intestine. And a lot of the diseases that affect our digestive system actually harm the mucous membrane, so then we actually can't absorb these nutrients. So for example, if you're living with celiac disease or IBS, IBD, lactose intolerance, you might be at a risk for deficiency in vitamin D. So just a note, for those of you who maybe don't know this, most of the work and research I do is around digestive and gut health. So if you have any questions related to the above illnesses related to digestive health, or if you just want to make sure that your gut and your digestive system is as healthy as it can be to promote the absorption of these really incredible nutrients, let me know and we can definitely have a conversation about gut health in you. So those are, the reasons for deficiencies because we get older, lack of the ability to absorb nutrients, and as we get older as well, we might go in the sun less. If you're somebody who wears sunscreen all the time or you don't get a whole lot of sun exposure, you're also at risk for deficiencies. So it is really important to meet our needs. So that's all I really wanted to talk about today for vitamin D intake. I hope that this video was helpful for you. If you want to comment below or if you have any questions, send me a private message. You can also contact me through my website, www.eatwellhalifax.com. Thanks again for watching. I really hope that you got something out of the video today, and I look forward to chatting more about nutrition and wellness topics, so stay tuned for more work. Next week we'll be talking about vitamin B, and especially vitamin B12. So thanks again, and eat well, Halifax.